Premier. So there were 173 locally acquired COVID cases reported to New South Wales in the 24 hours to 8 p.m. last night, and 58,988 COVID tests were reported during that period. As the Premier has indicated, it's really pleasing to see those high first dose vaccination coverages in our 16 pluses of 93.6% and 87.8% were fully vaccinated. In our 12 to 15-year-olds, we've got 79.3% have had their first dose and 62.3% are fully vaccinated. We've currently got 333 COVID cases admitted to hospital and 72 people in intensive care, and 35 of whom require ventilation. And going forward, as we work towards living with COVID settings, our eye will particularly be on those hospitalisations and ICU admissions as an indicator of the impact that COVID is having on the community. In terms of deaths, sadly we're reporting the deaths of 4 individuals, 2 men in their 50s, 1 man in his 60s and 1 man in his 70s. 1 man was from Western Sydney, 1 man was from southwestern Sydney, and 1 man was from Wollongong, and 1 man was from Newcastle. 3 had received 1 dose of COVID vaccine and 1 had received 2 doses of the COVID vaccine. The gentleman in his 70s died at the Tarrawanna Aged Care Facility north of Wollongong, where he acquired his infection, and he had received 2 doses of the COVID vaccine, and it's the 5th death linked to this outbreak. And can I extend my condolences to those who have lost loved ones. In terms of the key messages, as we transition to living with COVID, it was great to see people out and about and great to see those international arrivals and those reunited families. However, it is critical that as we go through this transition phase, we need to retain those COVID-safe practices. So as the Premier indicated, we have to continue to get tested. Even if you're fully vaccinated, you need to get tested. You need to stay home. Those small steps can really help us keep the virus transmission in the community suppressed. We need you to continue to wear masks, and the indoor mask wearing settings will be maintained until the 15th of December. And I really extend my appreciation to the community for understanding that this is a really important risk mitigation strategy for indoor settings. It's great to see the vaccine uptake steadily climbing, but can we just do that big push to get to that for 95% double vaxxed as soon as possible? And can I make a particular call out to the younger age groups? I know you haven't had access to the vaccines for as long as possible, but just to reiterate, there is plenty of vaccine and plenty of access points for you. The first dose coverage is 93% for each 5-year age cohort above 35, but for the 12 to 34-year-old age cohorts, it's less than that. So that group, we really want to see that age group between 12 to 34 shoot up and achieve that greater than 95% first dose and second dose coverage. And why that's important is we know that those age groups actually drive transmission. They're the connectors in our society. They connect with younger people and they also connect with older people. They also have more social contacts. So it is critical we achieve very high rates of coverage in those groups. In terms of the booster dose, please go and get your booster dose if you've had your vaccine over 6 months ago. It's critical that you present as quickly as possible to get that booster. We know the evidence is very strong that there is some degree of waning immunity, and having that vaccine at 6 months will really enable you to have the greatest protection, and that is critical as we anticipate that COVID case numbers will increase in coming weeks to months. Also, there will be a group in the community that have underlying health conditions that really suppress their immune response. So that's individuals that perhaps have cancer, renal dialysis, and for those individuals, ATAGI has recommended that you get a 3rd dose as part of your primary course. And just so there's no confusion, that additional dose as part of your primary course can occur 2 months after your 2nd dose. So if you have any underlying health conditions, check with your GP about whether you fall into the category of needing that 3rd primary dose or that booster. And remember, that booster dose is going to be currently with Pfizer, and even if you've had AstraZeneca, you will get a Pfizer booster, and we know that that will give you a good degree of protection.